Hello everyone and welcome back. So in this video we will discuss the types of examination of an ulcer. This is an important examination in surgery. So these are the basic steps. First of all, you have to do the greetings, the consent, and then the exposure of the patient, and then the following important points are followed. We have discussed how to do the greeting, the consent, and exposure in detail in our previous video. In this video we will just discuss the important points relating to the examination of ulcer. So first of all, you have to do the inspection. On inspection, the size and shape of the ulcer is checked using a tape measure. The number or single or multiple, whether it is single or multiple, you have to inspect for that. Then location of the ulcer is checked. That is, if it is varicose ulcer, then it is present medial aspect of the lower third of the leg. The rodent ulcer is present on the nose. The tuberculous ulcer is present over the neck. The trophic ulcer is present, which is weight bearing area, for example, heel of the feet. Bed sores ulcers are present over sacrum, and ischemic ulcers are present over the dorsum of foot and toe. Margin and edge of the ulcer. Margin is the border or transitional zone of the skin around an ulcer, and these are the types, that is hyaline margin, which is white outer, blue central, and red inner. Then we have inflamed margin, that is red irregular margin with inflamed surrounding skin, and fibrous margin, which are thick and white. Edge is the union between the floor and the margin of the ulcer. The types are sloping edge, punched edge, undermined edge, everted edge, and rolled out. Then we are having the to inspect for the floor of the ulcer, that is the exposed surface of the ulcer. We look for the type of granulation tissue and amount of slough, that is necrotic soft tissue not yet separated from living tissue, and nature of the discharge. Then we have to check for the surrounding skin, that is if ulcer is spreading and infected, the surrounding skin would be shiny red and edematous. Dark pigmentation and eczema is present, and varicose ulcers are present, that is varicose ulcers. Scars and puckering of skin is present, it is in the type of tuberculous ulcer, and if hypopigmentation, then it is non-healing ulcer, and if it's large scar, then it is Marjolin's ulcer. Then for on palpation, the surrounding skin is checked for temperature and tenderness, and the ulcer edge, floor, and base is checked. The edge is soft healing ulcer, firm is non-healing ulcer, and hard is malignant ulcer. For floor, the granulation tissue bleeding on touch. Healthy granulation tissue may show pinpoint hemorrhagic spots, while malignant ulcer may bleed profusely. Slough attached loosely or firmly. Then base tissue on which the ulcer rests. Base is palpated with gloved fingers. Consistency is checked. Underlying structures, that is muscle, fascia, or bone is checked. And check the fixity of the ulcer with the base. It is same as we check the fixity of swelling or lump. Focal examination is done. This part of the examination should not be missed. This includes regional lymph nodes, inguinal if ulcer is on lower limb. Palpate the arteries, dorsal pedis, posterior tibial, popliteal, femoral, etc. Always compare with contralateral limb. Examination of the nerves, that is especially sensory system, that is touch, temperature, pain, vibration, and compare with contralateral limb. Inspect the limb for varicose vein. If dilated tortuous veins are found, examine them thoroughly, is discussed in the next chapter. Check movements of the joints proximal and distal to the ulcer, and cover the area and say thanks to the patient. So this was the general steps for the examination. Then you have to present a description of the patient ulcers that is present. The diabetic ulcer is the most common type of ulcer that is usually present in the large number of the people. So here the description of diabetic ulcer is discussed. That is, this is middle-aged man who is known diabetic for last 8 years, and he is presented with approximately 3 into 3 centimeter painless ulcer on the sole of right foot for last 2 months. It is a single 3 into 3 centimeter ulcer located on the ball of the big toe, having punched out its, and the floor of ulcer is covered with necrotic slough. Surrounding skin shows trophic changes. The temperature over the surrounding skin is comparable with the contralateral sole, and it is non-tender. On application of the gentle pressure over surrounding skin, a serous discharge appears from the floor of ulcer. The ulcer is mobile over the base. On checking the pain and pressure sensation, there is reduced sensation up to middle of the calf on right side as compared to the left side. Dorsalis pedis and posterior tibial artery are palpable, and inguinal lymph nodes are palpable, and movements around the ankle joint are within the normal range. So this was all about the ulcers. So let's revise what we have discussed up till now. We have discussed that first of all the greetings are done, then the consent is taken, introduction is done, and exposure of the patient, and note the following points. So on inspection, the size, the number, the location, and the margin and edges of the ulcer, these are checked, the types are checked, the floor of ulcer is checked, and the surrounding skin is checked. Then on palpation, you have to check the surrounding skin, the ulcer, that is itch, whether it is soft, firm, or hard. Then you have to check the floor and the base, and check the fixity of the ulcer with the base. Focal examination is done. This part of examination should not be missed, and this includes regional lymph nodes, palpate the arteries, examination of nerves, inspect the limb for varicose veins, and check the movements of joints, that is proximal and distal, and cover the areas and say thanks to the patient. This is the description method. This is specifically for diabetic ulcer, but for other types of ulcer, the method is the same. So you have to represent it as the patient name, then who is non-diabetic for last 8 years, and then you have to represent your case, what you have examined, and what are the points that you have found in the specific patient. So in the next video, we will discuss the examination of varicose vein, and this was all about the ulcers. Thanks for watching.